There is no one-size-fits-all skincare regimen. Hi, I'm Dr. Athre. I'm a double board certified facial plastic surgeon based here in Houston, Texas. As much as we would all love to have just a simple regimen that we can just use day in, day out, that kind of stuff, that just doesn't exist. So what I decided to do is create this video that gives some sort of a framework on skincare as our skin changes through the decades. Now, please keep in mind, this is just a rough game plan. So a lot of these factors are more specific in terms of how your skin is, how your skin ages. These are all kind of a generalized game plan based on kind of what I call the bell curve, what the 50 or 60% of the population are going to fit into. So let's take it away and kind of figure out what would be the basic steps of a skincare regimen through the decades. So let's start off first with the 20s. As you're in your 20s, skin is plump. Skin has a lot of collagen, a lot of elastin. The maximum amount of collagen and elastin roughly is at about age 25-ish. So, skin is kind of at its peak performance. It's kind of like an athlete. So at this decade of the life, the biggest thing is prevention. So prevention from future damage. So I look at this in a couple of different ways. So sunblock, 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 sunblock. If there's one thing that I can tell you with respect to protecting your skin, it is sunblock. Now, there's a couple of other videos here on YouTube that we'll kind of link down in the description down below for more in-depth stuff about sunblock. But in general, anything to protect your skin from the harmful effects of the sun. Now, along with this goes the other side of things, the nutritional and environmental stuff. Meaning what? Stay healthy, be healthy, eat healthy, drink water, don't smoke. Those kinds of variables plus the sun protection, that's the primary thing that patients in their 20s should worry about. Of all of these things, the two most damaging things are UV light, that's the sun, and smoking. So if you can really target in on those are the main things. Now, let's jump to the next decade of life. In that next decade of life, now the skin is slowly starting to have a few more age-related changes. As we probably progress into our late 30s, we're starting to notice some fine lines, those kinds of things. Again, we can't forget the prevention, which is the sun protection, nutritional, hydration, and the no smoking. Now, however, I would really consider adding in a real skincare regimen. What does this entail? Well, I think retinoids are a fantastic thing to be used. Retinoids are vitamin A analogs, meaning they're in the family of the vitamin A molecule. There's two main retinoids that we see are triretinoin as well as retinol, which is available in different concentrations. It's basically kissing cousins of each other. They're very similar chemicals, but they're doing some very important things. You can think of retinoids kind of as a very mild chemical peel. So what it's doing is basically making the skin want to turn over. It's making those skin cells say, hey, don't go to sleep on me just quite yet. Let's rev up the production of some new skin cells. Let us increase the amount of collagen and elastin production. Those are some of the primary benefits of what retinoids are doing. So if you're starting to see some very fine lines, maybe some prominent pores, retinoids work great in trying to control, prevent, and repair. The other aspect of skincare regimens that should probably be added in your 30s are things that are breaking down some of the free radical damage. Antioxidants, vitamin C. These are a good class of agents to start using that in the 30s. Pigment correctors. So as we're in our 30s, we're going to get some degree of pigmentary issues on our skin, whether it's some small freckles and age spots, maybe a little melasma. And these things can be corrected with pigment correctors. There's several different chemicals in this category that can correct pigmentary issues. This includes hydroquinone, it includes kojic acid, azelaic acid, niacinamide. So these are some of the chemicals that you're going to see very commonly in skincare regimens, and those are really responsible for correcting some of the pigmentary issues. Towards the late portion of that 30s time period, this is where I would really consider definitively adding a little bit of Botox. So as that collagen production is starting to come down, you're going to start seeing some of the lines, especially here in the glabella, maybe a little bit in the forehead, and maybe a little bit in the crow's feet region. And just a little bit of Botox is going to help make that go away, but also prevent those lines from being very permanently etched within the skin. Now let's kind of move into the 40s category. So, this isn't a sharp division line between 39 and 40. It's kind of a moving spectrum in there. Now I think there's a little bit more intensity to which we need to really deal with the skin. Number one, again, can't forget the prevention issues: sunscreen, environmental, nutrition, no smoking. Two, do everything that you're doing in your 30s. Now I'd probably kind of up the game up a little bit with a little bit of microneedling to really trigger some of the collagen growth, and maybe even a deep chemical peel that can really help resurface the skin, maybe a little bit of fractionated laser to take off some of the old layers of skin and really kind of create an increased amount of collagen, elastin production, as well as regeneration in the skin and creating that more supple and dense looking skin that is associated with youth. Towards the mid portion of that 40s decade and getting into the 50s decade, you're really going to now see some degree of ptosis, which is the droopiness, as we lose some volume not only in the tissues, but also some of the volume loss in the bone underneath, as well as the laxity in the tissues. You probably are going to start seeing some degree of jowling along the jawline, little bit of increased amount of laxity in the neck, and maybe some droopiness or downfalling of the mid-face tissues with skeletonization of that orbital rim. In its very, very mild stages, these types of issues may be able to be corrected with volume replenishment. In my personal opinion, I love fat transfer for volume replenishment, and it works in two ways: not only adding volume, but also some of the stem cells that are within the fat are actually regenerating those tissues. Towards the more advanced stages of these things falling down, this is where patients really come to me and ask for things that are surgical procedures like facelifting, brow lifting, eyelids, those kinds of procedures. So I hope that this little video has given you a brief insight into how people age, skin ages, and what are the kinds of things you should be thinking about in different decades of life as you're going through this. Now, there's a few big take-home points that I really want to emphasize on this. Number one, through any of these decades, prevention is always better than the cure. So never forget about that sunscreen, good hydration, good nutrition, and please don't smoke. Number two, this video is really designed kind of as a generalized blueprint. Things don't happen at 29 and suddenly change at 30, or 39 and suddenly change at 40. It's a very dynamic process. Each patient is very different in how they experience aging, as well as what their goals are. So if you want more information on how to really help yourself during this process, come see me. Go see a facial plastic surgeon, someone who really specializes in aging face and facial rejuvenation, in order to be able to kind of get a long-term blueprint of both preventatives and curatives. There's also some very basic guidelines that I think are very important overall skin and aging facial rejuvenation maintenance. Overall health. Never downplay overall health. So rapid weight gain, rapid weight loss, changes in medications, even blood pressure issues, all of these kinds of things can really play an impact on how quickly you age, how quickly your skin ages, and how quickly your skin looks kind of aged and sallow. So having a good medical regimen with a good internist who's managing your overall health care, I think is also very important. So these are some basic ground rules that I think should be taken into account throughout one's life in order to ensure that they have the longest time of high quality skin with increased amount of volume, suppleness, collagen, elastin, all that good stuff. So first of all, if you liked this video, you want to know more about this stuff, or you want to be informed when there's more great content like this, please hit the subscribe button. If you have comments, questions, things you want to know more about, please leave us some questions down below in the comment section. I really appreciate you watching this video. Again, I'm Dr. Athre, Athre Facial Plastics, Houston, Texas.